suppression or malfunction. All those things may be some of the flowers in this garden, and we have to pick up each of these flowers and appreciate the peculiarity of each of them, and before deciding what is to be done. And the onset, these are some of the key points which I want to remember the assembly here. Thank you.
Thank you so much, sir, for sharing your thought-provoking insights with us. It would be our privilege to request Dr. Shrila Karanam now to address the gathering with a few words.
Good morning, all. First of all, I would like to thank Tripunithura College for inviting me to address you all. How many pairs you got from the previous presentations? How many pairs? We are doing repairing. We got so many pairs. I have observed so many pairs from here. First is cause and effect. Holism, reductionism. Ayurveda, conventional approach. Those are pairs. Sandarpana, apadarpana. Stula premehi, Visha premehi. Pre-diabetic and insulin resistance. Agni, Ama. Kapha, Medu combination. Prakriti Samprapti, Viridhi Samprapti. Prabhuda, Amila, Mudra. Then Ama, Kleda. Agni, Ama. Ruksha, Vishna. Lekhu, Ruksha. Then Homa, IR, HbA1c. Then energy level, mental status for all this. And finally, I am entering to Maheshu Datri. That is another pair, the first pair. Our Acharyas have given us a par excellent drug in the management of this diabetes. Sorry, Maheshu Datri. When I got this, the title of this conference, that is repair. So research on those pairs. That is I think that is the strategy of this seminar. My area, core area is with the pharmaceutics. So in the pharmaceutics, we are going through all the specialties of Ayurveda. And while preparing one of my composition, I have designed in that was prameha for Oshiti. And while doing that particular composition, our Acharyas, senior physicians asked me, why are you going to the project? And what is the intention behind that? So it is a market demand to have a composition for the management of diabetes mellitus. It was the company, as a pharmaceutical company, I got as a researcher, head of R&D and design and development program, I got a chance to build up this. But I had gone through the Nisha. It was that particular composition is the basics of premeha. So I have gone through the management principal sources of the Centenary. That is Amutra, Bhariveda, Slovakia, and that's Rasayana. All the active Abrumpana. These are the 5 steps designed by Sushruta. And again, gone through the Samprapti, every steps I have gone through. Then I got an information on Prunijivisa. What is the role of Krimi in beer? Nowadays, hermetic therapy is going on for the management of diabetes mellitus. Recently, we got an article from Fondias that is the hermetic therapy modulating host immune and metabolic syndrome that enhances insulin sensitivity, reduces chronic inflammation, restores metabolic homeostasis by the regulation of blood metabolic. This is the information I got from the particular article. So before that, when we started this Nisha Kalagadi Kashaya, we could see the very good and Ayurvedic property Nisha. Nisha is famous. And Dhatri Nishi, Nehishu Dhatri Nishi. That was my core area. This time explaining that Nehishu Dhatri Nishi. That is. Visha is also Vishahara. Vishahara is liquid. This Kapha Melu. Breakfast there, exercise there, everyone is there. So Vishahara, Pledahara properties. And here Dhatri Disha acts through the complementary antioxidant and inflammatory. We are going with the contemporary pharmacological terminology. Insulin sensitizing and weakness and protective mechanisms, addressing core metabolic and oxidative pathology of prameha rather than merely reducing blood glucose. This is a holistic. So, this is a holistic approach of Ayurveda. The Nisha acts on Hatmagni as a Hatmagni Deepana. Visha. Ojo Vardhanam. Visha. Dhatri Rasayan. This combo is applied in every stage of this prameha as preventive, and promotive, and its ratio proportion. It is well defined in our system with the Ayurveda Samhita, Chinisamhita, Ayurveda Samhita, Sushruta Samhita, how it is to be used, combination pattern that I will discuss later. We share going on this. Then the synergy gives us, the Nisha Dhatri Nisha synergy gives us strong anti-inflammatory, insulin, the Nisha is a strong anti-inflammatory, Dhatri is strong antioxidant, Nisha is insulin sensitizer, but Dhatri is insulin secretory. Kapha Melu Shalana is Nisha, Rasayan and Bhagya Posha is Dhatri, AGE inhibition is Nisha, and tissue protection by Dhatri. This is the synergy of this composition. And stage-wise application, Prameha Purviriva, here Agnes support and insulin sensitivity is addressed, and early type 2 diabetes, glycemic control and weakness protection, and chronic Prameha prevention of complication. This is the major synergy of this two composition, and I will discuss about later. How this Nisha and Dhatri is mentioned in our by our acharyas to address the management of prameha. Thank you.
Thank you so much, ma'am, for sharing your valuable thoughts with us. Now, I would like to request Dr. Minipi ma'am to share her views on the topic.
Good morning all. First of all, I would like to congratulate the seminar committee for selecting this topic, because we know that this spectrum of condition, this glycemic condition, it will contribute a major portion of morbidity and mortality and low quality of life. So, early prevention and treatment is important in this condition. And Dr. Seduraj and Dr. Alani Josa explained about the Vigati Parisha approach according to Ayurvedic principles. And our Vice Principal directed me to mention about the modern investigations related with this condition. So, I know all of you may are already aware of these investigations, but let me have a quick review of these investigations. Coming to investigations, we know that there are two phases of diabetes mellitus. First is the asymptomatic phase and second is the symptomatic phase. This preclinical latent diabetic phase is asymptomatic, but there is that hyperglycemia in this condition, and in the pre-diabetes phase it is also asymptomatic. Both these conditions, early detection of this hyperglycemia is very, very important. And we can categorize the laboratory examinations into four tests. First one is screening test, second for diagnostic purpose, third one for assessment of glycemic control, and fourth is the assessment of complications. And the commonly used investigations are for blood biochemistry, urine analysis, and immunological assays. And coming to the screening test, FPS, that is fasting plasma glucose test, it is considered as the most gold standard for this screening. And for doing screening test, all asymptomatic individuals above the age of 45 years do screening test. And now it is a mandate that we have to examine or do the sugar test whenever we collect blood. Whenever there is a venous prick, then do the sugar examination. That is the mandation. For high-risk patients, we have to perform the investigation at an earlier age. In Kerala, we have to do it at an age of 20 or 30, and so on. I am not focusing on the normal values, etc., just to mention about the test. Next is PPPS. At least more than 200 ml of PPPS in 2 occasions, we can do the diagnosis of diabetes mellitus. Another important test is GTT. There are 3 types of GTTs: standard oral glucose tolerance test, intravenous glucose tolerance test, and mini glucose tolerance test. This is the normal glucose curve, and this is the diabetic curve. This is the normal curve, and this is the diabetic curve. In normal condition, if you are doing intravenous glucose tolerance test, within 60 minutes, this glucose will return to normal. In diabetic mellitus, this decline is slow. Next, first different type of sugar test: fasting, PPBS, and RBS test. Next is GTT, and another test is HbA1c for knowing the glycemic control. It is the indications of HbA1c are it monitor the long-term control of diabetic control and diabetic medical compliance. And the advantage of HbA1c are it is not affected by diet or anything, and we can take the blood sample at any time. And it is advised to perform HbA1c test for twice in a year. For monitoring test, continuous glucose monitoring, and we have to get a comprehensive glucose level or glucose tolerance through this continuous glucose monitoring. There is invasive and non-invasive types of continuous glucose monitoring. Then self-monitoring of glucometer. Another investigation related with this DM is measurement of fructosamine assay. It is the measurement of glycated proteins, like glycated hemoglobin. Here we are measuring glycated proteins in the body. Then measurement of glycated albumin. Another test is measurement of glycated albumin. Another investigation is for assessment of insulin assay. It is crucial for type 1 diabetes mellitus, diagnosis of type 1 diabetes mellitus. Another test is pro-insulin assay. It is a precursor molecule of insulin, and the insulin divides into pro-insulin divides into C-peptide insulin. Another test is C-peptide assay, pro-insulin assay, C-peptide assay. C-peptide also for diagnosis of type 1 diabetes mellitus. Other investigations are adipokines. There are so many molecules secreted by your adipose tissue, example leptin and adiponectin. We can correlate this with the values with the insulin sensitivity. Another biomarker is microRNAs. It is an important biomarker for early diagnosis of diabetes. We can also do metabolomic profiling for early diagnosis. There are several genetic markers related with this diabetes. These are some examples for genetic markers. And so much auto-antibody tests are doing for research purpose and so on. These are some examples of these auto-antibodies. Another important investigation is performing HOMA index. It is for knowing the insulin resistance. HOMA index. I think you are aware of this investigation, HOMA index. There are two types of HOMA, HOMA 1 and HOMA 2. This is the homeostatic model assessment of insulin resistance. HOMA 1 is again divided into HOMA IR and HOMA beta. And HOMA IR is for insulin resistance and HOMA beta percentage is for evaluating pancreatic beta cell function. And the calculation of HOMA IR is fasting glucose into fasting insulin divided by a constant. It is 22.5 or 1.5. And the normal range is 1. If it is more than 1.9 or 2, there is significant insulin resistance. Then HOMA 1 beta calculation 20 into fasting insulin divided by fasting glucose minus 3.5. HOMA 2, it is a mathematical model, a computerized model. HOMA 1 is a mathematical model and this is the computerized model. That is all about blood test. Then coming to glucose estimation. First one is glycosuria. It indicates that blood glucose level of the patient would have been elevated more than 180 milligram per dl. Then only this sugar will appear in the urine. This glycosuria can also be seen in renal conditions known as renal glycosuria, and another condition known as alimentary glycosuria. This alimentary glycosuria, it is seen in hyperthyroidism also. There is lag in the storage of glucose in this alimentary glycosuria, and there is glucose in the urine. Then coming to the test for long-term complications of diabetes, it is urinary albumin or urinary protein, lipid and renal functions. This proteinuria is the first indicator of kidney damage or glomerular filtration function loss. We can do urine protein and microalbumin test. Then coming to lipid profile, there is elevated triglycerides, LDL and low HDL in diabetic patients. Then RFT test, do serum creatinine, urea, GFR, eGFR, creatinine clearance, albumin to creatinine ratio, cystatin C, and there are so many investigations to assess the kidney damage. Then test for acute complications of diabetes mellitus. First one is ketone bodies for urine and blood ketone bodies. Test for acute complication, ketone bodies in blood and urine. Then also test this bicarbonate, anion, arterial pH and partial pressure of carbon dioxide for diagnosing this diabetic ketoacidosis. For gestational diabetes, we have to do GTT. And there are so many respiration charts are available online. Coming to Ayurvedic part, there is a tool known as Medolab assessment tool. This is available in CCRA's site, and there are so many tools at the developing stage regarding the diagnosis of Medolab and diabetes. Thank you.
I sincerely thank Dr. Vinay ma'am for delivering such an insightful and informative session on the laboratory findings of diabetes. Thank you so much, ma'am.
Now I humbly request Dr. Srinivas sir to take over the moderation of the session.
Thank you all the experts that we have ended to the topic. So I think it is the duty and responsibility of the PG scholars and who are gathered here to extract the maximum knowledge from our experts and discuss the cases. I think everyone has shared a beautiful concepts. We are very much clear that Ajay and Charaga mentioned this disease as a Mahagana. That means in the general physician's perspective, it is very difficult to cure. And we are also very much clear that the prameha is a disease which is starting as a kapha predominant / slightly moving to Kapha Pitta predominant, and lastly ending with Tridosha with Vata predominance condition. So clearly, and Dr. Sethurai clearly mentioned that the role of the Kleda and the prameha tulya dushya. So when it is in the starting phase, we can clear it very easily because the treatment is very good. When it is going to the second stage, it is causing the vascular damage, and the third stage, the neurological damage. The conditions becomes more and more difficult to treat. So Dr. Anthony just clearly mentioned about the concept of the Kleda, that is the osmotic diuresis. That is, it is very clear in many of the conditions. In modern medicine, for example, the intravenous mannitol, it is working by this osmotic diuresis. But after the injection of the treatment, it should be stopped. Otherwise, this is going to create the vascular damage permanently. So that is the main cause of the loss of pericytes, and the disease is going to the next stage. Likewise, Dr. Sheila clearly mentioned about the tube, mainly the two aggrosha. One is Dhatri Nisha, other is the Vastigation Nisha. That means Kanvada is Aggrosha and Dhatri Nisha is Aggrosha. So Dhatri Nisha may be acting as a rasayana, whereas the prameha, Aggrosha, the Kleda manipulation, and the treatment of Kleda will be mainly through the Kanvada rasayana. So both having the equal importance when the pathophysiology is concerned. And Dr. Mini clearly mentioned about the relevant test. No need to go for all the investigations for a stipulated patient. We have to assess the dosha and go for the test which is relevant to that patient. So all the experts are clear, and the audience and we all are engaged to the topic. Now it is our duty to extract the maximum from the experts. So as my knowledge, there will be the questions coming. So the most benefited community of this assembly is the PG scholars, so don't hesitate to ask the questions. In my opinion, the question should come from the basic level. The basic level concept should be cleared, which is highly essential to understand the concept and for treating the cases. So I am inviting for the questions and the immediate and relevant responses from the PG students and the UG students. Okay, can we move?
Moving to the questions. First one, what is the significance of Ojashaya in long-standing prameha, and how does it relate to diabetic complications?
So this is a question which is based on the concept of Ojas. So I am also clearly knowing that during the prameha samprapti, the Oj is going out. So it is termed as the madhumeha. When we are reading the concept of prameha, two clear diseases, that is ikshumeha and madhumeha, can be correlated directly to the diabetes mellitus. All our prameha like udagameha, there will be sigadameha, that will be other diseases. But the blood sugar is the sugar in the urine, which is mainly coming in ikshumeha and madhumeha. So madhumeha is the last stage. So here the Oja, the concept and the role of Ojas in prameha, it is the first question. So I am inviting the response from the PG scholars.
As Sir said, we know what is stage of the Shukramana parasympathetic. We know the dosha especially involved in prameha, mela, mamsa, vasa, majja, kleda, shukra, lepta, vesica, and rasa. It is written in Charanam Chikitsa Sthana, Bahu Abadam, Mela, mamsa, Chariraja, kleda, shukra, sholida, vasa, majja, vesica, resista, ojala, sangyada, idi dosha vishesha, and Oja Sangyada, idi Oja Rupa. As majority of dhatus are involved, it can be considered as a Ojo share avastha, and in long-standing prameha, can correlate into Ojo share. And in Kiyanda Shilasiya Adhyaya also, it is as Sleshma Pitam Cha Vedam Cha Mamsam Cha Ani Pravartate Dairi Buddha Gavi Vayu Oja Avtaya Gachati. So we can correlate long-standing prameha as Ojo share.
Friends, please introduce your name, please.
Manita from Lanjara.
Dr. Manita, I think it is a very high, it's a relevant question. Dr. Sedu sir already mentioned about the concept of Baru Devaseshma and Baru Abadamena. I think it is the question, the answer should come from the conceptual part. So I am inviting Dr. Sedu sir to share his views.
Thank you, Srinivas sir. That was actually beautifully answered also. Probably I will add a little few points to the idea that you might have suggested. The one thing is, actually before going into understanding of the Ojas, we have to Oja Shema and Ojas. So what is actually the concept of Ojas to be? How is the concept of Ojas to be perceived? Actually, Ojas is considered to be the essence of all the bodies, and it's actually some total for the well-being of all the bodily constituents. Even the Udara method is only if it is in the state of normalcy, and we get the Ojas in the state of excellence. And we know that when we have the Ojas in the state of excellence, and Tushti Pushti Badode or Oja Vishwavi, and how can we visualize a kind of thing which is fearing and at the same time see them? What are the qualities of Ojas? For example, that we can see that it's quite contradictory in nature. It is considered to be a Taijasa power, but it has been assigned all the qualities which is seated in nature. So, can there be an Agneya power which is seated in nature? And here we have to say that Taijasam has to be explained as Prakasham, or the essence of the Prasadam, or the essence. That is the idea that we come across in the commentary there. That is, the term Taijasa power is not intended to convey the idea of something that is very really or intensely hot. Rather, it should convey that reflects the sense of something which is very essential or very clear and without any blemishness. So the blemishless being of the body entities may be considered as the Ojas. And we know that actually this is the end product of the well-being of the Ojas. And we know that during the process of Dhatu Parirama, we have the Saramsha and the Hittamsha. And we know about the Sara Pariksha also. And the Sara Pariksha tells that only if you have all your dhadus in a state with prabara Sara dhadus, then only you will enjoy the well-being of the dhadus. So if you have any of these dhadus in a state of Madhyama Sara or Avara Sara also, it is going to reflect in the decline of the overall strength. And that is what is, and we know that in prameha, if we come across Dhatupni Mandya and Sodharomni Agni Mandya, and we know that the Samprati in the very outset is very Sandarpanam in nature, and that can bring about Agni Mandya. At the same time, it will reflect more seriously in the context of this Dhatupni Mandya, and that is very clearly, very evidently manifested by the Prabhuda Svedam, Prabhuda Svedam, which is the expression of the Medo Dhatupni Mandya, and we know the Prabhuda Kledo Dushti. It's not a Kledo, Prabhuda Kledo Dushti, which is also the, and we know that actually there is a very beautiful narration of what is Kledo. Given in the Vyakhana by Rakhan Prabhupada in Vibhrati Vyakhana. It tells that whatever is the output of metabolism, which incorporates all things other than the dhadus, but still it is apyam in nature, and water that is actually the Rasadhadu is apyam. It is a value of the metabolism, but it is considered a that is the sort of metabolism which is apyam. So the dhadus should be clear of that. So there is that.
So Ojas is definitely going to be encountered not only from in all conditions, but particularly in Ojas being there. And we know that Ojas is actually the Saumya Bhava in the body, Saumya Bhava, and we know that all the balance has to be attributed to the Sthita Bhavas of the body. And whenever there is a depletion of the overall Dhatu chain and assets, and not only that, we have to consider the karma also. Prajata to balance, Prajata